My name's Anna Baker. I'm a cosmetic and dermatology nurse practitioner. I don't work with Aesthetic Source on a full-time basis, but I am involved in training all of their products, which includes RRS. Now, RRS is a very exciting and innovative type of biorevitalization, probably standing head and shoulders above other formulations in so much as it is actually a class 3 injectable device, which really does say a lot about the quality and the innovation behind this product. What we have also is quite a significant variety of ingredients. We have polyphenols, we have hyaluronic acid, multitude of different vitamins, and other more specialized ingredients like oligopeptides, and huge number of different ingredients that we can actually customize and mix together depending on what we're treating. So this is not a system which is designed just for the face. We have formulations to treat the scalp for hair loss. We have face, neck. We can do areas also for the hands. We can also treat conditions on the body like stretch marks as well. The other interesting thing with this portfolio means that we can actually mix certain products within this range together. We have over 75 different active ingredients within RRS, again, which is quite unusual. But it also means that we can actually cross a lot of those together, mix certain formulations together, again, to target a number of different concerns that our patients see, because it's very rare in clinical practice that people will ever walk through the door with just one concern. So we need to try and offer a comprehensive range of treatments. RRS will sit very nicely alongside peels, for those of you who are interested in doing peels in your clinics, other injectable treatments. It sits in very nicely. Okay. It's just out of interest in the audience, has anybody heard of RS? Is anyone using RS already? Just to give me a feel. Or is this quite a new concept to most people? Yeah? Okay. So, in terms of just some previous results that we can look at, these are not my before and afters. These have been shared very generously by some of our colleagues here from Skin Tech Group. But you can see the improvement just in the lower eye area is quite remarkable, and that's just, as we say here, periorbital areas. This is a 40-year-old lady who's had one of our products, our eye product for under the eye, which is absolutely magnificent, which targets not only darkness but also treats puffiness as well. And certainly when we think about the availability we have of injectable treatments for under the eye area, we are a little limited. So it's a very, very good product, one of my favourite ones out of the range. And then followed on by some daily care as well, twice a day. But you can appreciate, certainly in the picture from the right, the improvement in the dark circles is quite significant. Okay. In terms of cleaning the skin, I think across the board now we are becoming much more aware in the aesthetic sector of how important good skin cleansing is during treatment, certainly before treatment and after treatment as well. So I will be using a novel skin cleansing device, which we are the UK distributor for, which is Clinisept, which is antiviral, antibacterial, antisporicidal. Phenomenal product. So we'll be using that as well to ensure that the skin is well cleaned before, during and after treatment. Okay. Got my lovely willing victim here on the couch, Nikki. So, Nikki, can I just ask you just to sit up for me, just so we can look at you in side profile for a second. So, one of the first things we look at with Nikki overall, maybe just turn your head slightly, that's better, okay? So we can appreciate that the overall skin quality and texture of her skin is actually very, very good, okay? If I pinch her skin, she's actually got very, very little skin laxity. The only thing that I would say is if we look slightly lower down along the jawline here, she has some very, very early pre-jowling in that area. And we know that the mandible, from a bony point of view, undergoes significant change, lengthening, shortening and height, increase of the mandibular angle. We know that. However, we're talking about trying to correct and address some of the changes with the soft tissues. So one of the products from the range that I'm going to look at to demonstrate this area is one called RRS Tensor Lift. Okay, hopefully you can see that. Okay. This is one of my favourite products within the range. This is excellent for the lower face, sort of malar area of the face, the neck and the jawline. It has DMAE in it. For those of you who are not familiar, there are a huge number of ingredients in it, but one of the key ingredients with this, which gives a really good tightening effect, is dimethyl-ethanol. So it's a very, very good product. So we're going to mark out some vector lines across here with Nikki and inject that in microdermal papules under the skin. The other thing that we noticed with Nikki, as I said, in spite of the fact that her skin quality and texture is very, very good, if we just ask her to give a really nice big cheesy grin for us for a second, she has some really, really nice dynamic lines around the crow's feet area. So historically, of course, our go-to product would, of course, be the botulinum toxins. However, we do have other options out there now. As we know, we can look at peels, we can look at good quality skincare to target that area. But as another alternative, we have another novel range from out of RRS products called RRS Skin Relax. This is a product which doesn't necessarily just need to be used specifically around the eye area. This can be combined with one of our other RRS injectable products, which is really nice for the décolletage as well, and certainly around the lateral aspects of the neck if the skin laxity needs addressing there as well. It is very effective used around the upper three areas of the face, historically where we will of course be using our toxin for most of the licensed indications. This has an oligopeptide blend in it which has a similar effect in terms of competitiveness SNAP25 protein for toxins. So the mode of action with this is not so dissimilar in terms of what we utilise toxin for, but overall the effect is generally much softer. Okay, so thankfully in aesthetics we're trying to move away from this appearance of people looking very frozen, brows up in their hairline and faces just looking far too immobile. Okay, this is a very nice option to give a very nice natural softening effect, and because Nikki has really just dynamic movement here, there are no static lines there at all, this is absolutely appropriate for that indication. Okay, in a similar way this is also injected slightly closer together, just at 0.5 centimetre spaces, just micropapules just around the eye area. Okay, so I'll ask Nikki to just get comfortable now on the couch. Brilliant. So historically, mesotherapy obviously can be used with a needle, okay, with a short gauge needle. I'm going to be using a 32 gauge needle with a 4mm length. We could go even smaller. If the skin was very, very fine or if bruising was a concern, we could even go down to 33 gauge, okay. We do have protocols within RRS as well for treating areas like the hand, for example, where a cannula would be very, very nice to actually do some scraping just underneath the surface of the skin as well. Okay, so we'll just give the skin a good clean with our Cliniset products, okay. Prior to this demonstration, Nikki has had some topical anesthetic on her skin. She's had some Emla on for just over half an hour to just minimise any discomfort with this. This is a paraben-free range, and also RS has a very minor modification in it to also allow the formulation to be very well tolerated in the skin as well. Okay. So we'll just mark out initially where we're going to go, certainly with the terms of the tensor lift. As we saw when we sat Nikki upright, just sit up again for me, Nikki. Sorry, just once more. Okay. Just gently pulling some tension on her skin here. She has some very, very mild laxity along here. Hopefully you can see that. So to give the jawline and the superficial tissues a little more support, we're going to run a few lines of product across here and try and soften that shadow in just at the front there as well. Okay. Really nice big cheesy grin for me again. Just soften those lines just around the eye area there. Okay, and just relax back for me. Now, in terms of the protocol for the majority of these formulations, we are looking at an average of between 4 to 6 treatments, depending on the area that we're treating. The majority of them are done at a weekly interval, but the results are quite incredible and very, very natural. Okay, so Nikki, if you can just turn your head towards me this way, so we're just going to treat her around the eye area, okay? And just give you a really nice, big, cheesy grin. That's it, lovely. And just relax, okay? So, tiny micropapule just under the skin there. How was that? All right? And again for me, really big, cheesy grin. So, okay? And any visible lumps that you see just dissipate very, very quickly. As you can see, it has a very, very fine consistency, the RS formulation. And again, for me, really big cheesy grin. And just relax. And just relax. That's lovely. So we'll just do one more just to soften off this one here as well. Fantastic. Okay. Thank you. In terms of suitability for treatment, in terms of who we would and wouldn't treat, of course, patient expectation and thorough consultation is very important. Pre-treatment photographs, I tend to photograph my patients immediately before treatment and straight after treatment as well, because this is a treatment that's going to bring about a subtle improvement over a period of weeks. I think it's very important that we have very high quality, legible photographs to show that we can actually see a noticeable improvement with treatment, especially if this is going to be multimodal and something that's going to complement other treatments as well. Oh, okay, all right. Okay. All right, Nikki. So just bring your head just this way for me slightly. That's lovely. So the tensor lift can be injected in a number of ways. You could actually almost do a tunneling effect here to try and give some superficial tightening to the tissues. It could also be injected as a micropapule technique, approximately 2 centimetres apart as well. So I'm actually going to use a micropapule technique as well here for Nikki. And just under the skin there. All right. Nikki, how's that feeling? Is it okay? Is it uncomfortable? Okay. For those of you that can't hear, she's quite comfortable. Okay. Got the thumbs up there, which is reassuring. Okay. Does anybody have any questions about the technique or the product or how this can be used? Anybody doing any meso treatments themselves at the moment? Yeah? Okay. Hi.
Sorry,
All
yeah,
right,
so
lovely.
just shout. Yeah. Yes. I mean, I do provide mesotherapy.
Yeah.
I mainly use the U225 gun. Would that be an appropriate?
Absolutely. Sorry,
Okay.
that's a very good point. Thank you for raising that. Whilst I'm doing this manually today to really exaggerate the technique and the depth of the skin, you can absolutely use this with a gun. And a lot of people do. Yeah, so absolutely. Yeah, absolutely. Our stand number is D50, isn't it? In terms of coming to talk to us a bit more about the portfolio aesthetic source, our stand number is D50, so we can talk you through the full range of products, as I say, because we are literally just scraping the surface in terms of the full range and the full potential of what these products do. Just because of time, we're only able to obviously demonstrate just a small number out of the range. Okay. And this can be used, as I said, all along the neck, the lower face. This is also a nice option to use across the décolletage as well, in conjunction with those slight wrinkling that women can actually get in the middle of their chest. This is a very, very nice option and a very nice product. In terms of aftercare, standard rules apply in terms of what you'd be applying to your patients after their dermal filler treatment. I tend to advise no alcohol. Avoid touching the area. I don't like any of my patients to leave clinic with any makeup on, even mineral makeup. It's really, really important. As a general rule, I also try and encourage my patients to actually wash their hands before they leave clinic, because with the greatest respect, most people will immediately want to touch the area that they've had treated, and our hands carry such a significant number of different bacteria and organisms. So we'll just finish just here, just with this shadowing, just to try and reduce that a little for Nikki as well. Are you all right, lovely? Okay, just last 2 injections there. Super. Okay. Fantastic. Brilliant. This product doesn't need to be massaged afterwards, but what I will do is just spray the area, make sure it's nice and clean. I don't see any obvious signs of bruising. But of course, that is something to discuss with your patient at sign of consultation, especially when you're using a multipuncture technique. That's always a risk, okay? Just some slight redness here, but how's that feeling? Is that uncomfortable or is that tolerable? Okay. And if we ask Nikki to sit up just to see, we may see some improvement actually just in the jawline already. But she does actually look a little less shadowed across here as well. But of course, this is not a product that's going to give an immediate benefit to the skin. This will take time, and I would say allow a good month to actually see the final results from treatment. Okay. Okay. Thank you.